8. Good afternoon, everyone, and welcome to a COVID-19 briefing from the Rath Building. Of course, I'm Erie County Executive Mark Poloncarz, joined by Karen Gambino from Deaf Access Services today. We'll be providing the American Sign Language. Apologize for not having an interpreter yesterday. It was just very, very short notice, but thankfully Karen was able to come here today. We're certainly going to talk about the announcement by the governor of the cluster zones. I did. Yeah, but I think we're okay. We're here, of course, to talk about the announcement by the governor today with regards to the cluster zones, as well as to give the most recent information. It'll be just myself with Karen Gambino from Deaf Access Services. Before we go into cluster zone, I want to give a little update on where we are and why we're in the situation we are today. There are now 19,151 total positive cases through yesterday. Yesterday alone, there were 516 new cases in Erie County out of 7,451 case reports that were provided to the Department of Health, which turns out to be a 6.8% positivity rate. Confirmed through yesterday is now 758 people have died. We've seen a number of deaths in the most recent period. We have a confirmed amount of 758 through earlier yesterday. If there were others that came through in the afternoon and the evening, they'll still be confirmed. But unfortunately, we have had quite a number of people die in the most recent period. These are all lab confirmed cases, of course, and there's no presumed positives. Each of these individuals had COVID-19 at the time of their death. On November 16th, there were 185 individuals admitted to Western New York hospitals for COVID-19, 150 of them in Erie County. We've, of course, seen a rapid increase in hospitalizations over the last week to 10 days. Of the 150 from Erie County, 32 of them were in the ICU and 11 had an airway assist. Here is the data for Erie County as of the 16th. Steep increase in hospitalizations over the past week. And the latest data shows nearly 50% of all patients are 64 and under. It was actually 47%. So the individuals who are in the hospital are not just the elderly. And you can see it right here on this the graph, which shows the breakdown by age ranges. The age range that had the most patients hospitalized was 55 to 64 on November 16th. So this is not just older people coming from senior homes that are actually going to the hospital. There are a great deal of individuals, actually as you said, 47% under the 64 and under, who are being hospitalized, and the number one age range is 55 to 64. Here's an example looking at Western New York's hospitalizations. As you can see, the rapid increase in the last week after we had a steady incline for literally 2 to 3 weeks after basically months of being fairly stable. The diagnostic test criteria, we still have people who are calling. We just want to remind everybody there are many locations that you can get a COVID-19 test. Erie County Department of Health is testing those who are symptomatic or those that are close contacts of individuals who tested positive. It is free. You do not need an insurance card. You do not need a doctor's prescription, but you do need to call us and set it up, 716-858-2929. There are also dozens of other locations across Erie County to get tested, but these are all by appointment only. So now let's talk about the cluster zones. Earlier today, I had a long conversation with the governor, lieutenant governor, and key members of the governor's staff as we talked about where Erie County was. We went through the positivity rates, the rate of infection growth in our greater community. A determination was made that we had to put a good-sized portion of Erie County into the orange zone, and the remainder of Erie County would be in the yellow zone. So everything that was previously in the yellow zone has been turned to orange based on the rapid increase infection rate, and also the towns of Eden and Evans, because we've seen spin-off and growth primarily from what is the highest part in our entire community, the town of Hamburg. So orange effective, and I want to say before I begin this regarding the towns, for the business community and the businesses that are affected by the orange zone, and for the communities that are in yellow that will be affected by it, this takes effect as of Friday. For schools, it takes effect as of Monday. So there is a little bit of delay for schools, and they are giving businesses, the ones that are affected by the orange zone, the remainder of today and tomorrow to continue to have in-person service. And we'll go into what that means a lot more. But the orange zone includes the city of Buffalo, the city of Lackawanna, the city of Tonawanda, and the towns of Amherst, Aurora, Cheektowaga, Clarence, Eden, Alma. It should say on there Evans. It doesn't, but it should. Evans, Grand Island, Hamburg, Lancaster, Orchard Park, the town of Tonawanda, and the town of West Seneca. So everything that was yellow previously is now in the orange, including the towns of Eden and Evans, as you see on the screen, and was released by the governor earlier today. Yellow is the rest of the county. Alden, Boston, Brant, Colden, Collins, Concord, Holland, Marilla, Newstead, North Collins, Sardinia, and Wales. A lot of people say, well, you didn't talk about my village. We don't reference villages, we talk about towns. So if you live in the village of Williamsville, you're going to be affected in the orange zone because you theoretically are in the town of Amherst, but you could also be in the town of Cheektowaga. So if you live in the village of Akron, you are in the town of Newstead. So then you would, of course, fall in the yellow zone. This is effective, once again, for all businesses Monday. So as of close of business Thursday, Monday it would take effect. And for schools, it takes effect, or excuse me, close of business Thursday for businesses, it takes effect on Friday morning. For schools, it takes effect on Monday, so the next school week. Now, there are a lot of things that are covered by the orange and yellow zone restrictions. We've talked a lot about the yellow zone restrictions because of the sizable portion of Erie County that's been in the yellow zone for a little over a week now. And then the orange zone. So let's start with what's in the orange and what's affected. You cannot have non-residential gatherings of more than 10 people, indoors or outdoors. The same goes for residential gatherings, no more than 10 people. If you are in a yellow zone, if it is a non-residential gathering, so it's a meeting, let's say at a location, you can have 25 people indoors or outdoors. If it's a residential gathering under the new statewide rules, no residential gatherings can have more than 10 people. With regards to houses of worship, if you are in the orange zone, it is the lesser of 33% capacity. Make sure I read that right. Yes, 33% capacity or 25 people, the lesser of. And for a yellow zone, it is 50% capacity. With regards to businesses, there are certain high-risk, non-essential businesses that have to close effective Friday in the orange zone. In the yellow zone, they can stay open. And I'm going to go into that in greater detail because it's a little bit more than what people had heard previously. But it's all high risk as determined not just by the New York State Department of Health, but by the CDC. Dining. Everybody wants to know about dining. Outdoor dining, delivery, and takeout is still allowed for all bars and restaurants in the orange zone. You cannot have indoor dining. Yellow zone, you can have indoor dining as well as outdoor dining, but you're limited to no more than 4 people per table. So in the orange zone, restaurants and bars can no longer have indoor dining. They can have outdoor dining. It's limited to 4 people per table. Yellow zone, they can have indoor dining and outdoor dining. It's limited to 4 people per table. And then schools, the schools are to be remote except they can test out. And there'll be more information that is going to be provided to the schools very soon. The Lieutenant Governor and I were very adamant about giving the schools an opportunity to test out if they so want. The testing restrictions are not easy to meet, but they will have an opportunity to test out. Otherwise, they must go virtually. Now, this is different, of course, than in the red zone, where pretty much everything shuts down, including the schools, businesses, houses of worship to an effect, and no gatherings. So we're not in the red zone. It's highly possible some of the regions could have gone in the red zone, but they would have been so detailed. In some ways, it would have been unfair that one street would have been shut down, but the next street might have been open. So we felt it was best to ensure that we reiterated the dangerous situation that we have to try to stem the tide with regards to the growth of the coronavirus and COVID-19 cases. So a vast majority of Erie County, as I mentioned, is in orange. The rest is in yellow. And also the city of North Tonawanda in the county of Niagara has been added to the yellow zone. There was very much worry about the growth in cases in North Tonawanda, and considering the amount of cross-border shopping and dining that goes on, and the new cases, the governor's office informed us that it was important that they also included North Tonawanda in the yellow zone, even though it is not in Erie County. Now, the microcluster orange zone, it is very detailed as to what must close effective Friday. It is higher risk businesses associated with the transmission of COVID-19 viruses, including gyms, fitness centers or classes, barbers, hair salons, spas, tattoo or piercing parlors, nail technicians and nail salons, cosmetologist, esthetician, the provision of laser hair removal and electrolysis, and all other personal care services shall reduce in-person workforce in that area by 100%. So we wanted people to understand this is directly from Governor Cuomo's Executive Order 202.68. So this is not myself making it up. This is what's been in place with regards to the cluster zones for the orange zone. We did not put the red zone up here because if it was, pretty much everything would be shut down except what are considered essential businesses. And we don't want to go in the red zone, so we don't even want to talk about that. But we believe that it is important that the public understand who is affected as a business or an entity by this. It is generally locations where there are multiple people working together on the people in the public who then would travel in and out among the community. So it affects, once again, those that have a higher risk associated with transmission of COVID-19 virus as determined by the Department of Health for New York State and the CDC, which includes gyms, fitness centers or classes, barbers, hair salons, spas, tattoo or piercing parlors, nail technicians and nail salons, cosmetologists, estheticians, and the provision of laser hair removal and electrolysis. So if you are in that business, you can finish your work today, you can complete whatever appointments you have tomorrow, but then on Friday you have to stop the service under the orange zone order. New York State, Erie County will be enforcing this to our bars and restaurants. You can still do takeout, you can still do delivery, and you can still have outdoor dining up to 4 people in the orange zone. You cannot have indoor dining anymore. I know, and having been to a restaurant this past weekend, they were very concerned. We're all very concerned about what we're seeing, but we're seeing rapid growth in cases, rapid growth in hospitalizations, and now we're starting to see rapid growth in deaths. And none of us want to deal with that. I know people who died in the last week, not family members, not dear friends, but people I have come in contact with over the last few years. And I know that that's another family that's going to have one less seat at the table for Thanksgiving. And to bring that up before we take questions and answers, just like Governor Cuomo said, and I posted earlier today on social media, we need to learn from what happened to our neighbors to the north and west, depending where you are, in Canada. They had their Thanksgiving in October. Their Thanksgiving is always in October. They saw a big spike in cases and hospitalizations as a result of people gathering for Thanksgiving. That is why we are recommending that you do not have your normal Thanksgiving except with your immediate family members. So if you like watching the football games with Uncle Charlie, and you go over to Uncle Charlie's house, and Aunt Viv's, or of course Aunt Ginny, don't go to their house. Stay home. Watch the football games at home. Have the dinner with your immediate family. The Canadian experience showed that there was rapid spread of the coronavirus and COVID-19 cases from individuals who went to family and friends' house for Thanksgiving. Let's learn from their experience. This is not a war on Thanksgiving. We want people to have Thanksgiving. We also want people in 2021 to be around at the dinner table for that Thanksgiving. We hate to see the stories that come out of an individual catching COVID-19 from a family member who either didn't know they had it because they were asymptomatic, or just had like what they thought were the sniffles. Our Commissioner of Public Works, as it was revealed yesterday and is in today's paper, William Gary, is dealing with a mild case of COVID-19. It's so mild, he thought he just had just a stuffy head, but he couldn't taste or smell anything. He got tested, he has COVID-19. So Bill is in isolation at home, still doing work through the computer, and we wish Bill Gary and anyone else who's dealing with COVID-19 a quick recovery. But if Bill had not known he had COVID-19 and he visited a family member, he could have passed it on to that family member. That's why it's so important that with Thanksgiving coming up next Thursday, you please have Thanksgiving with your immediate family. Do not go to your fellow family members or friends that you normally would do, because there's a very good chance that you're going to be putting them in risk or yourself at risk, and nobody wants to do that. So I will now open it up to questions from the media, but once again, we just want people to understand this is a very serious situation. As the governor noted today, unfortunately, our area, Western New York, is the worst in the state. Erie County and some of the areas in Erie County are the worst in the state for positivity rates. We had hoped that this wouldn't happen, but it has. And now we have to address it. None of us want to do this, but we have to do it because this is not about politics. It's about saving people's lives. And I know we're going to lose more people over the next few days and weeks, but we need to do the best possible to reduce that number to the lowest level it can be. So please, please, I'm imploring you, follow the rules. I'm not going to be spending Thanksgiving with my parents nor other family members, and I ask you to do the same. With that, I'll open it up to questions. We will start on the list here. Is there anybody from Channel 7 WKBW? You need to unmute yourself. If you're mute, that's *6. If not, we will go to...
Can you hear me?
Sure, go ahead.
Well, the governor having some pretty interesting words for Western New York in particular, saying that we've never lived the full pain of COVID's wrath. I think that, some people might be offended by that who have lost loved ones. What's your take on that?
Well, I certainly agree with you that we know that unfortunately more than 750 people have lost loved ones, and we always offer our deepest condolences to them. I think he was comparing it to New York City, in which it was just horrible, absolutely horrible. Captain Sean Lavin from the New York National Guard is actually an employee of Erie County, and he was the one that was responsible with his team for the body pickup from the homes. And I've heard the stories from Sean. It was absolutely horrendous. And I think the governor was just talking about a comparison of what New York City and downstate was dealing with. And we did not deal with that. But that doesn't and shouldn't limit the pain that people in our community have felt because of the loss of a loved one or someone who's dealing with serious after effects of COVID-19. And on behalf of myself and the people of Erie County, we certainly want to offer our deepest condolences to those who've lost loved ones. Let's hope we never have to deal with what New York City did. We have a cold storage trailer for bodies in Erie County. We thought we were going to have to use it. We came really close to using it to the point we had 2 of them at the ready. We never had to use it. We still have a cold storage trailer, basically a mobile morgue at the ready if need be. Let's just hope we never have to do it because we follow the guidelines. WIVB Channel 4, Chris Orvadas, Dan Telvach.
Hey, Mark. A couple questions on a couple different points. First, I've been looking at the numbers over the past 48 hours, and I think I'm just surprised that nothing went red. I'm wondering if you share in my surprise that the worst we have is an orange zone.
Well, what you have to remember is we're looking at 7-day rolling averages of positivity rates, plus the impact on our hospitals, plus what is the impact per zip code or even down to the census tract block with regards to rates per 100,000 residents.